We had the staff meeting that first day, and they didn't know that they had a pharmacist coming in, but then the leader of the camp announced that, well, now today we have a pharmacist, and everybody was just screaming and yelling, and I was surprised, but yeah, they were very, very happy to have a pharmacist, on the camp. So yeah, it was a challenging experience, but I was very, very happy with the outcome. It obviously was not organized. There was no system at all. I looked at the MSF guidelines, and I started from there. This is how I started building the pharmacy. Building a pharmacy in the field is very much different from building a pharmacy in a hospital setting, let's say. So we started dividing the medication per dosage form in an alphabetical order. We started building our shelves. We had to look into every single packet, make sure that the expiration dates were fine, and that the packet actually had medication in it. And this is how we started, and that was only the beginning. This carpenter had André. His name is André. He pretty much lost everything, he had during the earthquake. He lost his wife. He introduced his two daughters to me. He brought them to the pharmacy, and they were in casts. And, they were, very, he was depressed because he always was telling me that he couldn't sleep at night because he lost his wife, and he's traumatized. He was working from 6 a.m. till 10 p.m. every night, and he was very grateful that we were, there trying to get this pharmacy, to work, and basically to give drugs to Haitian patients. So he was working nonstop from 6 a.m. till 10 p.m. every day. He barely took any breaks. He had lost his tools, so even the tools he was using were borrowed. So we requested from Mike Sorensen to bring tools from the United States as a gift from us to him. His story was very inspiring, and definitely he's somebody that I would never forget. We were actually the first pharmacy after the earthquake in Haiti to start with. Seriously, I can remember every minute of my stay. I don't think I forgot moments that I spent there on every single level. My connection with Haitians, and what helped was that the language barrier was not there. So I was able to connect with kids, with patients, with locals in general, and I did hire in the pharmacy locals to work. So I wanted to train people from there to take care of the pharmacy later. So, and also the connections with people you meet, international staff, whether from Europe, from South America, or from the United States. These people would be, probably my friends forever. I mean, we connect now via email or by phone because we shared such an amazing experience, and just going through, this tragedy, and dealing with this tragedy was just, a bonding experience for the staff. I would never forget Andre, who was, the carpenter. He would give me a hug every morning and a hug at night before he goes, before he leaves the pharmacy. So it was an amazing experience that I'll never forget. Yeah. And probably the most rewarding of my entire life.
Really?
Yeah.
Any patients you remember, or did you have much contact with patients? Or?
I had a lot of contact with patients, and because I am a new mom, I connected the most with babies, and younger kids, and specifically with one girl. Her name is Janica, and I used to go check on her 5 or 6 times a day. She lost her parents in the earthquake, and her 19-year-old aunt was taking care of her. She had burns, and we showed her aunt how to change her dressings, and I gave her antibiotics and food and clothing and all that stuff. And I was checking on her, many times a day. After a few days, you should see how, the changes. And I have the before and after pictures, and it was amazing how she just recovered. She was a happier baby, and that was, I was pretty emotional, and I felt that I made a difference right there. Sometimes it doesn't take much to make a difference, just a little things. So yes, Janica is one of the patients that I will never forget.
Yeah. And you have a 4-month-old at home?
I do. Well, he's 5 now, but
okay,
yes,
yeah.
When I left, he was 4 months old, and my biggest fear was that he would not, he would not remember me when I get back. But that wasn't the case. So I was very happy. Yeah, I was very happy. He did remember me, and I think my husband did a great job. So. So it wasn't, I was relieved, let's put it that way. When I got back home, I was relieved that he was just taken care of. He remembered me. He gained weight, which is great. So
was it hard to leave him behind?
It was the hardest thing, probably. Was the hardest thing. But, if I can help, and if I think that, people need help, I never say no, and I was confident that my husband can, take care of him. This is why I did it.
Yeah. And your husband?
I don't think anybody from the team took a shower for our stay.
Yeah.
So for me personally, I had to go through an intensive baby wiping session every night before I go to sleep, if I go to sleep. So it was very important for me.
And crutches, I remember, and sort of macaroni and cheese. The request for supplies included some things that you wouldn't imagine.
I was going nuts from eating nuts all the time. In poor countries, they usually have. They usually don't get vaccinated for measles, and the biggest fear, when in a disaster setting where you have so many people closed in one area in a camp, is a measles breakout, because that would be detrimental for patients and young kids who are malnourished to start with. And we did vaccinate per. Again, the UNICEF guidelines, so we did 6 months to 59 months, because we didn't have enough stock to just vaccinate everybody. Because, kids are more vulnerable, obviously, to measles.
How many people did you wind up vaccinating?
Between tetanus and measles, we did over 600. When I first thought about going, I had, little concerns that I may maybe not make that huge of a difference. I don't know. After I went through this experience, I truly, really feel that, University of Chicago had made a huge difference in Haiti. And we were able to accomplish a lot in just an incredible short time frame. And I'm really, really proud of what we have accomplished as a team and as an organization.